So, I've just done another amazing lecture from the CAM Symposium. It's all completely aimed at chronic pain, which is just obviously my bag completely and so fascinating. And one of the things I'm really loving is that they're talking so much more about behaviour. It's obviously something that we've known about for a long time, how much that the behaviour can influence your pain perception. But seeing that they're doing so much more research on it and talking about it more just means that we're getting loads more information on how this is useful and how we can use it on a day-to-day to influence pain perception. And so yeah, it's just really fascinating stuff. So what I'm offloading today is to remember that pain is not, or pain perception, your resilience to pain is not something you're born with. It's not whatever you're born with, whatever your pain perception is age 1, that is yours for the rest of your life. That is not true. There's a ton of factors that will influence your pain perception. And pain perception, because there's so many factors that influence it, is actually changing all the time, literally by the minute. I mean, you can be like, oh, I'm in so much pain. And then all of a sudden, Joe from over the road knocks on the door and you're like, oh, I got to get the door. And then actually your pain's pretty much gone then for that time while you're dealing with the postie or whatever else it is. And that's just one example of how your pain perception can be influenced. But there's a ton more than that. It's so much deeper than that. So obviously you've got your genetic factors and your microbiomes and all that stuff. But this one was particularly focusing on using behaviour as a tool, really. And so one of the things that they were saying is, well, there's loads of things that have been said, but, you know, increasing happiness, increasing serotonin, distracting you from pain, all these things came up. And so they were, the one that really stood out was using little games. And some of that works well because also dogs really love repeatability and predictability. And so having these little predictable games where they know the outcome is that they're going to win, it's actually really nice. So some of these games were just incredibly simple and you'd think, oh, how's that anything fun? But actually, I kind of thought about it and I thought, well, if you've got some time and you're thinking, oh, let's play a game with the family, your first thoughts tend to gravitate towards the games you know, those old card games you've played 1,000 times and you haven't got to think about what are the rules or is everybody else going to know how to play it or all those things. So I thought, actually, those simple games, they are quite fun. I mean, everybody knows how to play Snap. It's the quick go-to and everybody can play a game of Snap pretty easily. So I thought, yeah, that was really interesting. So it distracts you from the pain, it increases serotonin, these games are predictable. And it did also say that we need to remember that you can have a behaviourist as part of your pain management strategy as well. So you might want to enter them in as part of your team. And then the other thing I did want to say is that we know that increasing your, using the senses as part of your environmental enrichment is really important. So your senses come from your hearing, your sight, your touch, your smell, all that sort of thing. And so there's lots of different ways to engage with that. But one of them is to remember that food is actually the least calming of all of them. So if you are looking to create calming within your structure or strategy or your game you're playing, then keeping that simple rule that we just talked about actually makes it a lot easier, because if the game's too difficult, then all you're creating is frustration, and that's not actually conducive to calming or reducing pain. So I think there's a fine line to draw between learning and, you know, gaining skills and just causing frustration. So yeah, let's just bear that in mind. So the food has to be really considered when you decide if to use that as part of your strategy. And I mean, that's something I've talked about a long time, and this is why I have, certainly in one of my clinics, I have 2 rooms for treating patients, and one of them there is no food allowed in it, and the other room there is food that's allowed in it. And if a dog can't be treated without food, then I treat them only in the one that is allowed in there, because I don't want the smells of the treats from the patient before to be in that space either. And again, it just means that you've got that predictable outcome. The dogs know the rules. They know the rules better than the mums and dads. So yeah, just bear that in mind and have a real think. And yeah, keep asking questions, keep your mind open, and just remember there's lots of different ways to hit this pain, worry and concern, and we can get it sorted. There's loads to do. See ya, bye bye.